See, which of the following cells is most likely affected in this patient? A 50-year-old man presents with a 4-month history of fatigue, weakness, and pallor. He also complains of numbness and tingling in his hands and feet, macrocytic anemia, and hypersegmented neutrophils on the peripheral blood smear, and intrinsic factor antibodies are detected in his serum. So immediately I'm thinking like it's probably a B12 deficiency because of the paresthesia. The fatigue weakness is already telling you anemia, and they confirm that with macrocytic anemia and the hypersegmented neutrophils. Intrinsic
Good.
antibodies would mean like you're having trouble probably reabsorbing vitamin B12.
Okay,
So
perfect.
which of the following cells is most likely affected in this patient? Let's see. Enterocytes, hepatocytes, parietal cells, red blood cells, T lymphocytes. Um, I
So you got
think,
every piece so far. You've told me everything is great. You got your diagnosis, you got your mechanism action. So now they're saying, what can cause this, right?
yeah. So I'm thinking first instinct would be like, okay, what part of the body reabsorbs like B12? And that would be, let's see, intrinsic factor antibodies are detected in this here. So you're probably experiencing some form of deficiency in intrinsic factor,
Okay.
and parietal cells are important for that. So I would probably pick parietal cells.
Okay, final answer.
Yes.
Yeah, good. So this is called pernicious anemia, right? And so you have auto antibodies that's actually attacking and killing your parietal cells, right? That creates intrinsic factor. So you can't absorb B12 that well without intrinsic factor. Okay.
Right.
So yeah, I think you worked that beautifully. You got the diagnosis, you got the mechanism of action, then you connect it to, oh, what cell is going to be affected, right? So you just remember this term pernicious anemia, which is B12. It's like inflated. It's like a B12 absorption issue, right? Because you can eat a bunch of B12 and still not have enough because your intrinsic factor helps you absorb it. So that's the reason why your parietal cells are play such a key role of getting B12.
Okay.